Hey everyone! So, I haven't been feeling all too well over the past couple of weeks, and I'll tell you what makes it more tough when you're not feeling well is when you're living in a country that's not your country and you don't understand how the health system works and you don't know if you can get to see a doctor/dentist. So as you might be able to tell by my hamster face, I have got a horrible toothache. I don't have the official Brussels residential care here because I'm not a Brussels resident yet. So right now I'm debating whether to go to a private dentist office or whether I go straight to the hospital.
Bonjour, je voudrais un renseignement s'il vous plaît. Bonjour, ça c'est bien la dentisterie. J'ai un problème avec les dents de sagesse.
How the hell are you supposed to get help with this type of thing? This has pretty much been a recurring theme in Belgium since I moved here, so I thought that since I've finally sorted it out, I would just make a quick video to kind of update you on it and let you know how I did it. So the solution is very simple. You get something called a mutuelle or a mutualité, and this is basically the way that the healthcare system works here in Belgium, is that you pay this basic amount per month so that you are entitled to get money back anytime you visit a doctor or basically just anything essential to your healthcare. You can add add-on packages to that if you want to be extra covered if you have to go to hospital or extra covered for routine dentist operational things. But your basic healthcare is going to cover things like emergency dental care. So let me tell you, in order to be eligible to get this mutuelle or mutualité, you need to be able to prove that you are paying into the Belgian social welfare system. So if you've got a regular contracted job here in Belgium with a Belgian employer, you're set. If you are freelance or work for yourself like me, it's a little bit more complicated, but you just need to make sure you're paying something called cotisations sociales. I'll put a link in the description. It's a legal necessity, but if you are paying those things, then basically from when you started your job contract or paying your cotisations sociales, you can get reimbursed for any medical care that you've had that's covered by the mutuelle you end up signing up for. So now it's January, I'm only just signing up and doing the paperwork with my mutuelle, but I've been paying my cotisations sociales for months, so I can get receipts from any medical work I've done through that time. And as long as it's covered by this basic mutuelle, then I can get money back on it, which is fantastic. The other thing to note about a mutuelle is you don't have to have your residency sorted out yet in order to sign up for one. The one that I've decided to move forward with is called Partena. There are loads of options, I'm not going to go through them all. Partena has been contacting me in English, which I really appreciate because I get so stressed out speaking French. So yeah, I went to the dentist a couple of weeks ago and I ended up having like emergency root canal treatment. I'm going back in a couple of days for the final round of treatment, which is why I'm not making a long video this week. I've got a lot of other things to do. And I want to chill out when I've got my face all numb. So wish me luck at the dentist on Friday. So in conclusion, if you've got a toothache like I did, don't be silly like I was, and just make sure that you're covering these steps and you're going to be fine. It's so much easier than I thought it would be. And that's it. Have a good week, guys. I'll see you in my next video. Bye.
Is this real life?